It's Naisha Williams, and I will be doing my health assessment, head to toe assessment for NSG 5340, health assessment didactic in with South College. So we're going to begin. I have my patient here. I've already did his vital signs, his history and physical. We've already got his height and weight, and I've done hand hygiene. He's okay with me continuing without gloves. So can you tell me your name and date of birth?
Charles Carter.
And your date of birth?
August 25th, 2008.
And what month of year is this?
April 15th, 2026.
All right, and can you tell me what city and state you live in?
Houston, Texas.
All right, so patient is alert and oriented times 4. Can you look at me? And just looking at him, I see that he doesn't have any abnormalities to the face. Can I have you take your hat off, please? He has hair that appears to be groomed. I don't see any scaling or flaking. So I'm going to proceed. Can I touch your hair just to feel for any bumps or lumps? I'm also going to be looking for bruising. There's no discoloration. I don't see any scaling or flaking. No lumps, bumps. I don't see any bruising. No nits or lice. Hair is well groomed. And yes, so next, moving on. I'm looking at his face. Eyebrows are symmetrical. Look up, please. Look up. Eyes are symmetrical. Patient does have a little bit of acne. Next, I'm going to check his sinuses. So I'll start with the frontal. I'm just going to touch. Any pain?
No.
All right, any pain?
No.
No sinus pain, frontal or maxillary. Next, I'm going to check his lymph nodes. All right, any pain?
No.
Any pain?
Mm-mm.
Any pain here?
No.
Pain here?
No.
Pain here?
Mm-mm.
Here?
No.
All right, so lymph nodes are not tender. They're present, movable. Next, I notice he does have facial hair. I'm going to next move on to his eyes. Can you look at me, please? And just looking at his eyes, sclera is clear. His eyes are brown. I don't see any discharge or drainage from the eyes. Next, I'm going to check his pupils, which is also checking cranial nerve 2. Look at me. All right, pupils are equal and reactive. Equal, round, and reactive. Let's see. I'm just going to check your conjunctiva. All right. Conjunctiva is transparent. No foreign bodies, no discharge noted. I'm also going to check cranial nerves 3, 4, and 6. All right. So just look at me, and you're just going to follow my finger, and I'll move your head. All right, cranial nerves 3, 4, and 6 are intact. Next, we're going to assess his optic disc as well as his retina. All right, so you're just going to look straight ahead at me. Right, straight ahead at me. Right, so what we're checking for is a yellowish orange disc, which seems to be intact and in place. Next, we're going to assess his nose. So nose does not have any discharge or drainage or any lesions or skin breakdown on the outside. It appears to be, nostrils appear to be symmetrical. Next, I'm going to check inside the nostrils. Right, I don't see any abnormalities noted to the nostrils. I'm going to next check his cranial nerve 1, olfactory. So I'll have you close one of your nostrils and you're going to smell for me.
No.
Okay.
No.
All right, cranial nerve 1 is intact. Next, we're going to move on to his mouth. So lips appear to be pink and moist, no cracking or bleeding noted. Can you open wide for me? Next, I'm going to be checking cranial nerves. You can close for me. 9 and 10, as well as 7 and 12. All right, so open for me. Okay, uvula is midline. Tonsils are present at about 1+. Tongue is pink and moist. Move your tongue left to right, please. Okay, and then open wide for me again. I'm going to check his hard and soft palate. And then I'm also going to check his teeth. Smile. Teeth are intact. Can you blow your cheeks out? Okay, squeeze your eyes shut and scrunch your nose, your forehead. Okay, awesome. Cranial nerves are intact. Next, we're moving on to the ears. Looking at the external ear, The ear does not appear to have any discharge on the outside, no lesions or sores. I'm going to touch any tenderness or pain.
No.
No tenderness or pain to the right ear. Next, I'm going to check the ear canal and check the tympanic membrane. All right, pulling the pinna up and back. Tympanic membrane is intact and pearly. I don't see any drainage or redness or bulging to the tympanic membrane. Same to the left ear. No lesions, no discharge outside the ear. Checking for any tenderness or pain.
No.
Okay, no tenderness or pain. Gonna check the ear canal and the tympanic membrane. All right, tympanic membrane is intact and pearly. No redness or bulging noted. Okay. Next, we're going to move on and assess his neck. All right, look straight ahead of me and sit up all the way, please. Okay, straight ahead. I'm gonna check for any abnormalities. First, looking, trachea appears to be midline. Swallow for me. Right. We're gonna next check his thyroid. So, just gonna move the carotid cartilage to the side and swallow. All right, thyroid is intact. Next, we're going to check the carotid pulses one at a time. Right, and the other one. Carotid pulses are present, bounding. Next, I'm going to check for jugular vein distension. Slightly turn your head to the left for me. Right. No jugular vein distension noted. Slightly to the left. No jugular vein distension noted. Next, we're going to check the lymph nodes. Any pain or tenderness?
No.
All right, no pain or tenderness. All right. Next, we're going to move on, and I'm going to assess his lung sounds. I'm going to auscultate lung sounds. Deep breath for me. Deep breath. All right, next I'm going to check for any egophony. So I'll need you to say E for me.
E, 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 E.
Okay. Next I'm going to check for any tactile firmities. So 99.
99, 99, 99, 99.
All right. Next, I'm going to be assessing, percussing the lung fills. All right. Next, I'm going to get you to swing around for me. I'm going to listen to the back. Your lung sounds in the back. All right. Sit up for me, deep breath. Okay. Next, I'm going to check for egophony, 99. E. Okay. Next, I'm going to check for any tactile firmities. Can you say 99?
99, 99, 99, 99.
All right. We're going to percuss the lung fills. All right. While I have them this way, I'm also going to assess his costovertebral. So I'm going to percuss here. And just checking for any costovertebral tenderness. Did that hurt any? Also going to feel for any masses, tenderness. Okay. Any pain there?
No.
All right. So I'll have you turn around for me. All right. Next, I'm going to assess his lung sounds. We're going to start with the aortic, which is the second intercostal space on the right at the sternal border. Pulmonic is the second intercostal space on the left at the sternal border. Next, we're going to assess the herbs, which is at the third intercostal space on the right at the sternal border, and the tricuspid at the fourth intercostal space on the right sternal border, and mitral is the fifth intercostal space mid-clavicular line. Next, I'm going to palpate the pericardium. Right, and next I'm going to percuss the borders of the heart. All right, and next I'm going to check for any murmurs at the between the fourth and fifth intercostal space, mid-clavicular line with the bell. All right, now no murmurs heard. Looking at his chest, it appears to be equal and symmetrical. Shoulders appear equal and symmetrical. I'm going to assess cranial nerve 11 by getting you to shrug your shoulders for me. Right? Thank you. And then I also get you to put your arms side to side. Your ears, touch your ears to your shoulders. Great job. And that's assessing cranial nerve 11, which is intact. I don't notate any pulsation, abnormal pulsations, or any of that. Next, I'm going to assess his arms and skin. Skin turgor is quick recoil. Arms don't have any bruising, any lesions. Skin is intact. There's hair on the arms. Checking his nails for any clubbing. No clubbing noted. Checking the capillary field, which is less than 3 bilaterally. Next, I'm going to check his pulses, the radial and the brachial. All right. Right arm, both are intact, about 2+ bounding. Same for the left arm, both are intact, about 2+ bounding. All right, next I'm going to get you to, you're going to lift your arm up for flexing. We're going to extend it, push it back to extend it. All right, and out for abduction, in for adduction. Same with the left arm, up for flexion, back for extension, out for abduction, in for adduction. Okay, awesome. Next, we're going to do the Flayland and Tensile test, just checking carpal tunnel. So we're going to have your arm out like this and down. All right, good. And just going to tap those carpal tunnel ligaments, any pain or tenderness. All right, like this for me. Typically, we'll hold for 60 seconds for Flayland's test. For the sake of the video, we're not doing that. You're relaxed. Any pain or tingling, none noted. Next, I'm going to check reflexes. So the brachioradial. The bicep, all right, tricep, awesome. We're going to also do it on this arm, brachioradial, bicep, tricep, all right. Next, we're going to assess his patella reflexes and Achilles, all right. And I'm going to also check cranial nerve 5. Close your eyes for me. Tell me if it's soft or sharp.
Sharp.
All right, cranial nerve 5 is intact. Next, I'm going to get you to assess your vision. Visual acuity, read the smallest number you can read, line that you can read.
C, F, D, H, J.
All right, next eye backwards.
J, H, F.
Okay. All right, 20/20 vision. Okay, next I'm going to get you to lay on your back so I can assess your abdomen. All right, and while assessing the abdomen, I'm going to lift the shirt up. Skin is intact. There's some hair on the abdomen and some stretch marks, but other than that, it appears to be fine. No abnormal pulsations. I'm going to go ahead and palpate, starting with the right lower quadrant for pain, tenderness, or any masses. Any pain or tenderness? Okay, next I'm going to percuss all fields. Checking for tympani and dullness. Okay, next I'm going to auscultate all fields, starting with the right. Right. Typically, we wait up to 5 minutes to hear bowel sounds. For the sake of the video, we're not going to do that. Okay. Next, what we're going to do is check for Murphy sign. So I'm going to palpate the right upper quadrant and release. Any pain with that?
No.
All right, checking gallbladder. Next, we're going to do McBury's, which is the right lower quadrant, checking for appendicitis. And any pain with that? Next, we're going to check for Rothschild sign, left lower quadrant. Any pain to the left, to the right lower side? None. Okay. Next, Rossing side is negative. Next, we're going to check for orbiter signs. So I'm going to have you bend your knee up, and we're going to pull it out, pushing your thigh in. Any pain with that? To the left, right lower quadrant? Nope. Next, I'll have you turn on your left side. I'm going to take this leg and we're going to bend it back for psoas. Any pain to the right lower quadrant? No? Okay, you can turn over. Next, I'm going to check for any splenomegaly. So I'm just going to palpate under the 10th rib. No splenomegaly felt. Next, I'm going to check the femoral and the iliac arteries. So there's the iliac and the renal arteries. The renal arteries is about 3 centimeters above the umbilicus to the left and the right, and the iliac artery is about 3 centimeters below the umbilicus to the left and the right. Assessing those, and we would also assess the femoral arteries. For the sake of the video, we're not going to do that. Next, I'm going to check his pulses, popliteal. So we're going to check behind the right knee and the left knee. Pulse is intact. Going to assess the skin on his legs. It is intact, hairs on legs, no open bruising. Skin is warm to touch. Skin turgor intact, no edema noted. Next, I'm going to assess for any. I'm going to assess for any the sensation on the legs. Is that sharp?
Yes.
Right. How does this feel?
Soft.
Okay. All right. Next, I'm going to assess range of motion. So I'll have you put your leg out for abduction. All right. In for adduction, we're going to flex and extend. Same with this one. Out for abduction. In for adduction. Flex and extend. Next, I'm going to have you plantar flex your feet. You're going to down and then dorsiflex up. Next, I'm going to check strength. So don't let me pull it back. Pull up. Don't let me pull it back. Right. Hold your leg up. Don't let me push it down. Okay. And the other one, don't let me push it down. All right. I'm going to check your pulses. Posterior tibial pulses are present. Dorsal pedal pulses are present and bounding at about +2. Next, I'm going to have you swing around, sit up for me and swing around. And then you can stand up. We're going to have you bend over. And I'm going to check your spine. Spine is midline. Any pain with this?
No.
All right, no pain. I'll have you walk to the wall for me. And then back on your tiptoes. All right, and then you're going to go back on your heels. Okay, awesome. Next, we're going to check your Rosenberg sign. So you're going to stand here, close your eyes. And this is checking cranial nerve 8. Okay, awesome. All right. Yeah, I think that's everything. All right, and that concludes my head to toe assessment.